if something that as an emergency is happening, most of the time you will know. So a heart attack on the whole is extremely painful. It feels like something is crushing the middle of your chest. People will often fall down to the floor holding their chest in pain. If you see that or you feel that, 999 straight away. Don't wait. With a stroke, people might lose the movement on one side of their face, or one side of the face droops, so they find that they can't use their arm. It can affect the speech. You might find their speech starts getting slurred. So again, if that happens, just phone 999 straight away. Or actually with a stroke, I often say at the moment, if you've got a car and you live near the hospital, put them in the car and get them to the hospital. Unfortunately, in terms of the build-up to that, if you've never been diagnosed with heart disease or a condition, sometimes it's silent. So the reasons why these health checks are so important is because they can find out what your risk is and whether there's anything silent going on, whether cardiovascular disease, so the disease that happens in your blood vessels, you can't feel it, you can't see it without any medical technology. Knowing your numbers, if you've got high blood pressure, you're more likely to have a stroke, so it needs to be treated, you need to bring it down. That's really important. Sometimes people get something called angina. So when you have heart disease but you're not actually having a heart attack, it's almost like your heart goes through a phase of not getting enough oxygen, and it causes pain, and then the blood flow comes back again and the pain goes away, and that causes chest pain. So if somebody is regularly getting chest pain, perhaps every time they go for a walk, it never used to happen before, and suddenly when they go for a walk they get a pain in their chest or they get short of breath, you should definitely see a doctor about that, because that could be a warning sign that something's going on and needs treatment. But if you feel well, the most important thing is living as healthy a lifestyle as possible and getting those checks so that things can be diagnosed early.
What do you think are the sort of like barriers that stop Black Africans or Caribbean population, especially in the north of Manchester or across the whole of Manchester, from accessing healthcare? What are the barriers?
So I think one of them is a word we've already used today, trust. Other barrier is the cultural competence of the services. And I will often say, so I'm a realistic person, I'm not expecting every service to be culturally competent. How many cultures are there in the world? Yeah. Can one service ever actually be culturally competent forever? Yeah. That's just, it's not going to happen. But you can have cultural humility. So you can say, okay, I recognise that because of your faith, because of your heritage, maybe because of your sexual orientation, because of the community you're from, because you have a disability, I recognise that that is going to have an impact on how you receive the care and the service that I'm provided. I might not completely understand what that needs to look like, but I recognise that I'm going to listen and I'm going to value who you are as a person. And then for some services, the way to then make it culturally competent is to work with a community organisation that is led by people from that culture. So when you get that partnership between the community organisation and your statutory service, you can then see how there's a way of doing something that then becomes culturally competent. And then the other one is just racism. And I think, as I said, that was dismissed more before the pandemic. I think since the pandemic, people have become more aware that racism in of itself has an effect on people's health, and is one of the reasons why some people have poorer access to services than others. And even if they get into the service, their experience of the service and the quality of the care that they get isn't as good as somebody who isn't racially minoritised. So addressing racism is really important.
What confidence what would you say in terms of giving somebody confidence to still interact with the healthcare system and services and professionals, because at the end of the day, there are people within that system, so they can at least still address their health to improve their health outcomes?
So, I would always encourage people to come forward and access the services that, they're entitled to access. I have to say, never worry about going to see your GP. GPs are madly busy. A lot of them are very stressed. All of that is true. It is very hard at the moment. But, I used to be a GP and it was my job every day to see patients. That's your job. That's what they're there for. So don't worry about it. Yes, it's hard for them, but it's their job. If you've got something going on, that's what they're there for. You need to go. If you're worried that perhaps you don't have the confidence, you're worried maybe you don't know how to explain what's going on, is there somebody that can come with you, a friend, somebody from your family, or maybe some of these community organisations that do outreach and work with communities? Some of them have people who'll be prepared to come alongside you and, do that visit with you the first time. So it's really important that people do just reach out and access those services, because it's very important.